So rectal thermometers and weather stations, we want to make sure that we're monitoring their temperature and their humidity. They can't regulate their body temperature on their own until they're at least 3 weeks old. And we want to continue to make sure that the surface temperature is adequate. Now, I personally don't like heat lamps because I'm worried about them dehydrating. And I just try to avoid them as much as possible because I just don't think that they're safe. You don't want to feed puppies, either let them nurse, tube feed them, or bottle feed them until their rectal temperature is at least 36 degrees. Because if you do, then they're going to end up with an aspiration pneumonia situation. You want to make sure that their electrolytes are adequate, and you want to make sure that they're clean and dry, that everything is going well for them, that they're in good place. Now, the fourth thing is going to be food and fluids, because we've got to get them breathing, we've got to get them warm, we've got to get all those other things to happen before we start worrying about food. So very important that we talk about this. Now, small for gestational age puppies, low birth weight puppies, this is kind of a problem. We know from, again, NeoCare's data that low birth weight puppies, so puppies that are in the smaller 25% of their breed, have an 81% greater chance of dying in the first 48 hours. So big puppies have a better survival rate than small puppies. And we also used to say that up to a 10% weight loss in the first 24 hours, oh, that was okay, puppies would be fine. But the NeoCare data says if they lose more than 4% of their body weight, that they have an 8-fold greater increased risk of death. So 10% weight loss is not okay. We want it to not exceed 4%. And if you're seeing puppies that are starting to lose weight, it's important that we start intervening with bottle feeding or tube feeding. It's pretty simple to keep track of this stuff. I think everybody should have a notebook, piece of paper, a pen, and a ruler, and they should be able to mark where their puppies start off at weight, what their temperatures are twice a day, what their weights are twice a day, what the color of their urine is twice a day, and what their APGAR scores were. We're going to talk about early neurological stimulation tomorrow night, so we will kind of skip that column for now, but you can identify all your puppies on this. It does not take sophisticated equipment to do this. And you can pretty easily monitor these guys to make sure that they're doing what they should be. Now, if you're computer savvy and you like Excel spreadsheets or numbers for Apple people, that's great. Go ahead and do it. You can graph it, but you don't have to have this level of sophistication to get the kind of information it takes. So this was one of the very first spreadsheets I ever had a client bring me. And I looked at this, and this was probably 12 years ago. I looked at this and I said to the guy, so, like, do you have a spreadsheet on this puppy? And he sort of sheepishly said to me, how do you know it's a spreadsheet? I thought, well, you're an engineer and you work at GE. I'm pretty sure you didn't just make these numbers up, because he was telling me things like this puppy gained 71%, but this puppy gained 12%. I'm like, yeah, nobody just pulls those numbers out. Let me see the spreadsheet. So he sends it to me, and I looked at this and I said, okay, John, you've got 2 puppies that are in big trouble. You can see these 2, yellow puppy and white puppy, are not gaining weight. You can see black puppy is like off the charts, taken off. But these were low birth weight puppies and they weren't gaining very well. I said, you need to come in. So he brought the puppies in, and the 2 puppies, the little ones, were septic. They had each sloughed a toe off of their back foot because of sepsis. He hadn't noticed that. He's an engineer. He didn't count toes, but he could do a spreadsheet. So I don't care how good you are at monitoring puppies. If you need to do it by the numbers, if you need to do it by just looking at them, it's up to you, but I'm going to give you the numbers that you need so that you know what to monitor, because some people are really skilled. I can show a video of sick puppies to the Old Lady Poodle Club in Milwaukee, and they can pick a sick puppy out in a 15-second video. I have other people that can be in the room with me for an hour, and I can't teach them that this is a sick puppy. So I've got to give you numbers you can monitor. You can monitor their weight, you can monitor their urine color, you can monitor their temperature, you can monitor their glucose. Those are all things that you can measure. And by doing so, we have a better opportunity to save these kids. So we know that large litter size tends to lead to smaller puppies because there's only so much room in the uterus. So when we have larger litters, we tend to have smaller puppies. And we know that those large litters, again, have a 4-fold increased risk of neonatal death because, number 1, they're low birth weight puppies. Number 2, they have a slow delivery. And number 3, they're somewhat oxygen deprived by the time they're born. It's a long way down the uterus. So it's very important that we're monitoring these guys. So based on early growth rate, we know that we see an increased risk of mortality when we have puppies that aren't gaining initially. Now, this is one of my own litters of puppies. Obviously, there are 10 in this litter, and this picture was taken before there was Photoshop. There were really 10 puppies, all in baskets, all at the same time in this photo. But you have to remember, it's all about the real estate. So when you have large litters, there's only so much room in the uterus. There's only so much real estate for those placentas to attach to. So it's sort of like this tree that's hanging out here on this rock. If you have 14 puppies in the uterus, somebody's getting squeezed out. And so there's always going to be a puppy in the middle, puppy on the end, a puppy that got squeezed, got too close to the cervix, didn't get a good location. Placenta didn't get a good stake of real estate. So this picture, I think, is a really interesting picture. These are 2 litters of corgis owned by the same breeder, born on the same day, both at my clinic, both born by C-section. There are 4 puppies in one litter and 8 puppies in the other. Now they're in 2 separate incubators, but you can see that the mat has the same size dots on it in the 2 incubators. So if you compare how big the puppies are on the left with how big the puppies are on the right, you can see there's a huge difference. So the bitches were fed the same, they're the same breed, out of the same genetics, all the same stuff. But when you have 8 puppies, they're just going to have to be smaller because there's not room. So maternal nutrition is essential, related to low birth weight puppies. We've got to get those girls eating. And if their puppies are being born without enough opportunity to nurse, we're going to have to support them with a bottle feeding or with tube feeding, and potentially plasma if they're not getting colostrum. So what have we measured? All of these things. So now we're going to talk about getting them started breathing. So the first thing we need to do when they're being born is get the membranes off the face. We're going to suction with a Deely mucus trap. And this is what a Deely looks like. It's a very simple device. You really can use it very intuitively. It has 2 parts to it. It has this white piece that goes in your mouth and the other skinny piece that goes in the puppy's mouth. And you can see here, Heather is in this picture. She's got this chamber full of all this fluid that she's suctioned out of these puppies. You can see she's smiling because she stopped before the fluid level got to this level, where then if it filled any further, she would be sucking this up into her mouth. So when the chamber gets about half full, you pop the top off, you dump it off, and you continue suctioning. So these are a great little device. They run about $10. I think they work much better than a bulb syringe in clearing fluid out of the puppy's airway. You can use a bulb syringe, and I tend to alternate bulb syringe with Deely mucus trap, but I have better success with a Deely getting a lot of fluid out than I do with just a bulb syringe. So I like these devices quite a bit. They do a really nice job of getting fluid out. Then they need oxygen. Like I said, the oxygen concentrator gives us 95% oxygen. If you have a puppy that's still not breathing, you can take this 25 gauge needle and you can put it in the puppy's nasal planum. And by doing this, you can get the puppy to start to take a breath. That is respiratory stimulation point GV26. So it does a nice job of stimulating puppies to breathe. If they're still not breathing, I'll use caffeine. Now, the new caffeine product that we've been using is 5-Hour Energy. It's the stuff you buy at the truck stop. It has caffeine in it. It has a little glucose in it. It tends to help to get these puppies to start breathing a little bit more effectively than without it. If they're still not breathing, I will use Dopram as an injection after 10 minutes after they're born. So that's why we want the stopwatch. We want to know when those puppies are 10 minutes old. If they're not breathing, they're going to get a Dopram injection. Now, Dopram is a little controversial among anesthesiologists because when you give Dopram, you increase the demand of oxygen to the brain at a time that oxygen is not being well delivered. But I will tell you that there are puppies in the world out there that wouldn't be here if we hadn't given Dopram. I tend to give it into the tongue, and I don't give it until the puppy's at least 10 minutes old as my last resort. So they're already going to have been suctioned, Deely'd. They're going to have an acupuncture point. They're going to have a little stimulation. They're going to get caffeine. And if they're still not going, then we're going to give them Dopram. Keeping them head down if there's still a lot of fluid in the airway can be helpful. This is obviously a stuffed dog, but it shows you that elevation, that the rear end above the front end will help keep the puppy's head down and get the fluid to drain. It is not the same thing as swinging. Do not swing puppies. Now, if at 10 minutes they're still not breathing, or perhaps even sooner than that, we're going to intubate those puppies. Now, the picture on the right is an adult dog, but it shows the correct head position for opening up the airway and doing an intubation. The tube on the left is a coal tube. Now, this is not something most owners are going to be able to do at home by themselves, but at the veterinary clinic, you can ask your veterinary technicians to learn to do intubation of your puppies. Now, this again shows that curl to the pink tongue. If the tongue is pink and it's got that curl to the edges, I'm going to keep working on this puppy, even if it's not breathing very effectively. This shows a puppy with a tube in the trachea. We'll put the coal tube in using a laryngoscope, which is this lighted source on the left-hand side, and then the coal tube on the right. Now, I take this coal tube with this gray stylet. We've made these stylets. So if anybody's working with a veterinary clinic and they want information about this, you can send me an email and I'll show you how to do this. But we'll put the stylet down into the trachea without the blue tube. We'll put that in with the laryngoscope, and then we'll pass the blue tube over it and pull the gray stylet out. And we actually make this stylet out of a TCI catheter. So this is something that we have at our veterinary clinic pretty readily, and I'm happy to teach other veterinary technicians and veterinarians how to do this. So we'll put a laryngoscope in, we'll pass the stylet, then we'll pass the endotracheal tube, and then we're going to ventilate that puppy to get it started breathing. And you're going to say, well, I can't do that at home, but I want my vet techs to learn to do it. And I'm going to tell you that your vet techs will work for food. Many vet techs skip lunch to take care of your dogs. They stay late to take care of your dogs. You need to feed them chocolate chip cookies, chocolate pie, pizza. I don't care what they like. Take them food. And if you pay your vet techs in a little extra food, they're going to walk through fire to help you save those puppies. So I will teach them how to do this if you want me to help them. As a last resort, if you have a puppy at home that's not breathing and you don't have the ability to put a tube into the trachea, you can take your bulb syringe, tuck it way at the back of the throat and squeeze it. And hopefully you can get enough air into the puppy's lungs that it'll start taking a breath. Because like I said, with the balloon exercise, the first breath is the hardest breath. So once they take the first breath, the second, the third, the fourth get easier every time. So if you can get that first breath and you've tried mouth to mouth and you've tried everything else, that bulb syringe might help you. If you have a stethoscope at home and that puppy still has a heartbeat, I want you to keep working on it until the puppy doesn't anymore. Hypoxia, like I said, it can be combated with the oxygen. When we're resuscitating our puppies, we keep them warm and safe. We tend to put heating pads in this gift wrap tray, those big, long plastic trays, so that the puppies don't roll over the side. This is a litter of 16 puppies, all in their colored towels. So this is why we do it, is we can keep track of what puppy was born when, what the resuscitation efforts were, who needs special attention when they get home. So the colored towel system really does serve us well in this way. This is the incubator and the oxygen concentrator that Puppy Warmer sells. I swear by this. If you have brachycephalics, if you have difficult puppies to raise, this is going to be a really great set of equipment for you to have. The heat source I use is the T.E. Scott whelping nest. I like to heat from underneath. And we know from Ken at Puppy Warmer that if you look at your puppies, you let them tell the story. If they're laying out long, they're stretched out like the puppies in the bottom picture. They're comfortable. They're warm, they're happy. If they're piled on top of each other, they're too cold. If they're comfortable, stretched out, or they're laying on their back, they are very happy. Now, puppies like a thermal gradient, meaning there can be warmer and cooler spots in their environment, and they can pick. But like I said before, we want to give them only good choices so they can't crawl off and get too cold. Why don't I like heat lamps? I've set my barn on fire with a heat lamp. If you haven't tried that yet, I don't recommend it. But our barn nearly burned down when we had a heat lamp over one of our baby calves. It melted the fiberglass calf hutch she was in. Instead of it being 4 feet tall, it ended up 6 inches tall. So I don't like heat lamps. I'm just so afraid that they're going to cause fire, overheat, cause dehydration of the puppies. I just don't think they're safe. So the last thing I want to talk about before we start the question and answer session is dipping the umbilical cord. So when we do this, this is after we've tied the cord off and before the puppy goes into the incubator, we're going to dip the umbilical cord, and I do mean dip. So we put the tincture of iodine, which is iodine combined with alcohol, in a small bottle. And then we're going to literally dip the cord. So I don't mean kind of dab a little bit on there. I mean literally dip the cord. We want the entire cord to be encircled by tincture of iodine. The iodine will keep bacteria from ascending up into the abdomen. And the alcohol will help dry the cord so that it's going to dry up and fall off more quickly. I see puppies that die from umbilical infections. It's very easy to prevent. The tincture of iodine is a combination of alcohol and iodine. You can buy it that way. You can mix it yourself if you can't find it, but it does a tremendous job of getting those cords dried, cleared off. I have personally lost a puppy of my own to an umbilical infection. At 2 o'clock in the morning, he was fine. At 4 o'clock in the morning, he was dead. And I opened him up to take a look and see what happened. And that's what it was an ascending infection. And that was back in the day when we were using chlorhexidine. So I was dipping the cords, but I was dipping in chlorhexidine instead of tincture of iodine. And it didn't adequately dry the cord and allow it to drop off. And before I even realized he was sick, he was dead. So I'm very, very specific about this. And I hate to see anybody lose a puppy to something that would have been so simple to prevent. So you can use whichever tincture of iodine product you can get, but I do strongly recommend that you do that, because if you're losing puppies and you don't have a good answer for it, we're going to talk tomorrow night about postmortems, but I encourage people to do a postmortem on all their puppies. So if you do lose a puppy, you know what happened and you can prevent it next time, because we know the definition of insanity, and that's doing the same thing over and over again and expecting a different outcome. So if you're losing puppies, don't just lose them. Don't just shrug your shoulders and say, oh, well, it happens. No, find out what happened, learn from it, and try to avoid it in the next litter, because there's no reason to keep losing puppies. It's just not okay. I want 100% of your puppies to survive. So I went through a lot of information tonight. I know we've got this, a lot of information in the handout. These are the two books I've written. The one on the right is the Canine Reproduction and Neonatology book. It's 500 pages. It is a big, thick, fat book. It's written for veterinarians, but it's also written for breeders. So I want you to be able to use this as a resource, because we have a lot of information in there that can be really helpful for you. So I want you to all hang around for the Q&A session that we have coming up. So we'll be breaking after this to come back for a few Q&A.
Awesome. Thank you so much, Dr. Greer. Your tremendous knowledge and just very practical advice is fantastic, and we're so happy you could join us again.
Thank you.
For those that don't know me, my name is Alice Keith, and I'm with Purina Pro Plan. And before we take a quick break, we're just going to take a few minutes to talk about what we offer to breeders with Pro Plan and with our Breeder Loyalty Club, Pro Club. So for those who aren't familiar with Pro Plan, we are a very nutritious dog and cat food brand backed by a team of over 500 scientists. Real meat, poultry, or fish is always the #1 ingredient in all of our highly digestible dry dog food formulas that promote nutrient bioavailability. And I don't know if you know this, but Pro Plan is chosen by more dog show champions in both US and Canada than any other brand. It's for these reasons, many others, their own personal experience by many veterinarians like Dr. Greer do recommend Pro Plan in their practices. Okay, next slide, if you could advance it.
I can. I will. There we go.
Awesome. So our #1 formula with breeders, no surprise for many of you that feed Pro Plan, it's our Pro Plan Performance 30/20 All Life Stages formula, as it does support the nutrition and energy needs of pregnant and nursing bitches and their puppies. So 30/20 stands for 30% protein and 20% fat. And this concentrated nutrition helps optimize oxygen metabolism for increased endurance. And that is also why it's very popular with sporting and competition dogs. That said, we have a very full assortment for a lot of different nutritional needs. And yeah, lastly, if you're interested in trying Pro Plan, our breeder program Pro Club offers a lot of great benefits, including savings on every purchase of Pro Plan, free delivery for large orders in most regions of Canada, and breeder savings at select retailers, as well as a rebate program for purchases in stores. And what we think are the best puppy kits on the market for your new pet owners, including a small bag of Pro Plan, 3 cans of wet puppy food, and much more. So if you'd like to learn more or sign up online, please visit us at purina.ca/ProClub. So with that,
hi everybody, we're back. I'm just waiting for Dr. Greer to get back on for us. We're getting ready for the Q&A now. Don't forget, I want you to keep the questions about general questions about the topics that were covered tonight by Dr. Greer. Try not to get into questions about your own specific dog. All right, are you ready, Dr. Greer?
I am.
All right, let us go then. Susan wrote, explain using an acupuncture needle under the nose to get a newborn to start breathing.
Okay. So basically what you do is you take a 25 gauge needle if you have one that small. If you don't, a bigger one is okay. And you want to put it halfway between the upper lip and the nostrils. See if we can go back to the video. And there's two methods. One is you can kind of peck in and out. So right at this location. So halfway between the nostrils and the upper lip on this line. They don't come with a little green X on it, but they do have this little dotted line down the middle. So you take your 25 gauge needle and you can either peck, so boop, 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 in and out, or you can turn it, put it in and twist it. And basically that's GV26 acupuncture point for respirations. Now, if you've ever uncapped a needle while you're vaccinating dogs with you put the cap in your teeth, which you're not supposed to do, but we all do, and then pulled it off and then poked yourself in the nose with it, you will know that's also an acupuncture point to make you say a 4-letter word. But you will take a very deep breath as you begin to swear, because that will stimulate you to breathe. So we'll use that after the airway is cleared if the puppy's not breathing or not breathing regularly. You'll hit some bones. So you can only go in a little ways. You only go in about 1/8 of an inch. You don't go in all the way. And it's just enough to get some puppies to take their first breath.
Very good. All right. Elizabeth wrote, can you breed a sire who had Lyme disease?
Ooh, that's a great question. We see a lot of Lyme disease here in Wisconsin. So you can breed them. If they're on antibiotics like doxycycline, it won't cause any harm to them, but so that the doxycycline won't cause a problem, but you might not have great semen quality if he was running a fever or was ill for a while, but he will not transmit Lyme disease to the female. So it is safe if his semen quality is good. And doxycycline or other antibiotics will not interfere with semen quality. So yes, we do not recommend breeding bitches that have active Lyme disease. So if we get a positive Lyme test at our pre-breeding exam and it's positive on the female, we'll follow that with the IDEX C6 test. That's a quantitative test to see if it's an active infection or not. And we don't encourage people to breed their bitches if they are actively infected, because pregnancy is an immunosuppressive condition. And we've seen a fairly significant number of bitches have their Lyme disease flare up at late stage pregnancy and become very, very sick. And at that point, we are really reluctant to use doxycycline on those pregnant bitches. So we try to avoid breeding the pregnant ones, or breeding the ones that are Lyme disease positive and getting them pregnant during Lyme disease, but the males should be okay.
Christine wrote, what is the equivalent of the blood sugar level in mom, which is the measure we use here in Canada?
It should be exactly the same in a puppy as it is in the mom. And I was going to look that up. I know how to convert progesterone numbers, but I'm not sure what your glucose measurements are, but I'll have it tomorrow night. But whatever is a normal blood glucose level for an adult dog is the same in a puppy. So here 90 is 90. I'll have to look it up for you guys.
Okay. And Jill wrote, can you explain how to give caffeine and the dosage?
Sure. So again, we're going to use caffeine. I used to use no-dose, the caffeine tablets, and just dissolve those in water. And those work pretty well, but they're kind of granular and it leaves kind of a gritty residue in the mouth of the puppy. The 5-hour energy is just a liquid. We'll put 1 or 2 drops on the puppy's tongue. We don't inject it. We just put it on the puppy's tongue. On the human side, they use caffeine on newborn babies. They see less sudden infant death syndrome, better respirations. So they do use caffeine on the human side. They use it in baby horses in foals. So we started adapting that to use in puppies a long time ago. And we do see some nice improvement in their respirations. They're more regular. They're deeper respirations if we can give them some caffeine. So I just use the 5-hour energy. It's easy to find. You can get it at almost every store, carries it at the checkout line, at the gas station, at the truck stop. And it's not expensive. It's just a couple dollars. And once the bottle is open, you can keep it for a long time. So it's just a couple drops on the tongue, and you can repeat that if you need to.
Susan Dixon wrote, what is the brand name and model of the oxygen concentrator you mentioned we could use to bring oxygen up to 95% for pups?
The brand that we use is made by Puppy Warmer. It's this product here. He has two versions, the pro version and the regular version. It runs about $900, but once you buy it, this is going to last you probably for the rest of your breeding career. So it has this tubing that hooks up to the incubator, and then this blue chamber on the front of it is where you put the water in so that it'll deliver humidified oxygen so that the puppies aren't being dehydrated. It's delivering the appropriate amount of moisture at the same time it's delivering oxygen. So this is the brand I like. It's meant for puppies. It's developed for that reason. And we've had really good success with this product. It lasts a long time. It's pretty quiet, and it delivers very reliable oxygen to the puppies.
Susan Haas wrote, is the umbilical dip 50% iodine and 50% alcohol?
That's pretty close. The product that we use is this one. It's 7% iodine, but yes, you can mix your own if you need to, 50-50, and just make sure that you're getting the alcohol mixed in there so that it dries the cord.
And Jill wrote, how can we order your book?
Oh, that's easy. You can order it on Amazon. If you want a Christmas present with an autograph in it, you can let me know and I'll send it out. If you have it somebody that in particular you'd like to give it to. I like to have people buy 2 copies, one for themselves and one for their veterinary clinic, because the vet clinics oftentimes will use this as a resource but may not know it exists. It's a great gift for a vet student, a great gift for a breeder. So this is a good time of year to be buying Christmas presents for people that you think highly of.
Very good ideas. D. Jones wrote, how to deal with stuck puppies. Best way to get them unstuck if veterinary care is not available or you're on your way to emergency.
Sure. So there's a couple of techniques you can use. I never reach into the bitch's vaginal tract without the gloves on for 2 reasons. One is you want to protect yourself in case she has any kind of bacteria like brucellosis. 2 is you want to protect her so that you're not introducing bacteria. So you can put some lubricant on your hand like KY jelly. You don't want to use Vaseline. You don't want it to be petroleum based, but it should be water based like KY jelly. You can reach in your hand vaginally and see if you can get a hold of the puppy, either their head or their back legs. If you get a hold of the back legs, you want to pull both at the same time. You don't want to pull one because the puppy's going to get more stuck as it gets kind of sideways in there. If you can get in far enough to get a hold of the puppy, great. If you can't, you can put a second glove on and you can reach in rectally. Make sure you wear a glove for this for sure, because you don't want your fingers in the rectum without a glove on. And sometimes that gives you just enough advantage. You can get a little further forward and get either behind the puppy's head around their neck or in front of their pelvis and just kind of get traction on it and then pop it down into your opposite hand. Sometimes standing the bitch, her front legs up on a chair or a flight of stairs can be helpful. Again, you get a little gravity. You can use a lot of lubricant. Some people will take a feeding tube and put the KY jelly and liberally lubricate the vaginal tract with that. And I've also had one client tell me something, and I haven't tried it because the only dogs that have come in that I've had the chance to think about it on have been pretty big sized bitches, but on small bitches, she said she was putting them on her lap with their feet up in the air and bicycling their back feet, and that would seem to help move the puppy through the birth canal. I've also seen some people say that they've put those gloves on, the exfoliating gloves that have a little friction, a little traction, and reached in vaginally and gotten a hold of a puppy with those. So there are some techniques you can use. Those are probably the best advice that I have for you. Of course, oxytocin is useful in very, very small conservative doses. You don't want to give too much oxytocin or you'll shrink wrap the puppies and actually make the situation worse. So small itty bitty doses of oxytocin and either oral or injectable calcium can help with uterine contractions and get things moving as well. And then I'll use a lot of ice cream for my bitches during labor, not because there's enough calcium in ice cream to compensate for the calcium that you're giving with the calcium gel, but because there's glucose, there's fluid, and a lot of those bitches are 12 to 24 hours from having had their last meal. They're not eating, they're not drinking. And that fluid and that glucose and that energy helps to get the bitches pushing a little bit better. And of course, taking them out and walking them, sometimes just getting them up out of the whelping box and going out. And when the days are short, like they are here, You want to take your flashlight and a towel, because I've seen bitches squat and it's been dark and you haven't realized that they just dropped a puppy outside in the dark. So take your flashlight, take your towel, and make sure that you stay with her on a leash. Don't let her just wander off into the dark part of the yard by herself, because you may end up losing a puppy out there and not realize it. So those are my techniques. And if you get into trouble and you can't get anywhere else, then sometimes it's a C-section.
Okay. And my handler Serge asks, you may be covering this tomorrow, but if we breed in a 5-day period, it's possible to get a puppy a 5 days maturity apart?
No, the general thought is that all the eggs are ovulated at the same time. So breeding over 5 days doesn't mean you're getting puppies that are 5 days apart in age. They should all be conceived at around the same time. It just gives you a chance to expose the eggs to a longer period of time, because if you're not timing the breeding with progesterone, you may not know exactly when she ovulated, but you will not have puppies that are 5 days different. If you have small puppies, it's either because, like I said, with that tree on the rock, that the placenta didn't get a good foothold, so you had a crummy piece of real estate, or that the puppy was small for gestational age for some other reason, like crowding or too big a litter or something else. But puppies are all thought to be conceived at this within a 24-hour period, pretty much at the same time.
Matt Garrison wrote, thoughts on liver water for weak neonatals?
I don't use that. I use formula. I know there are people who like that, but if I have a weak neonatal puppy, I'm going to give them electrolytes. I'm going to give them puppy formula. I use some either Karo syrup or Eagle brand sweetened condensed milk, any of those things to give them some energy, but liver water has never done it for me. I don't think there's enough nutrients in liver water to do any good. The sweetened Eagle brand sweetened condensed milk now here in the US, I don't know what you have in Canada, will come in either a pouch or a bottle with a flip top. So once you've opened it, instead of having that can with a big opening and a big gooey mess on your hands, it comes in those nice bottles. And then once they're open, you can keep refrigerated, and that'll give puppies some glucose, some energy to get them started. So those are the products that I use. Either the Puppy Light electrolyte formula for puppies made by Revival, Eagle sweetened brand condensed milk, or real formula, Esbalac, Foster Care, one of the actual puppy lactation formula supplements.
Marceline wrote, will the iodine solution used to dip the cords be for the mother dog if she tries to clean the puppies?
It doesn't taste good, but it won't hurt her. She'll leave it alone pretty well. We don't want her ripping at the cord anyway. So generally, if it's just right around the cord, it won't interfere with her ability to mother the puppies.
Okay, Brenda wrote, do you dip the umbilical cord in tincture of iodine just once, or is this repeated the next day?
Oh yeah, I didn't say that, did I? We dip it at birth, at 2 hours, and then 3 times a day until the cord falls off. You're right, I should have included that information.
And Nicole wrote, I have always done bulb suction on puppies. How far does the tube go in the mouth puppy with the daily suction method?
It goes in about an inch, a couple centimeters. You don't need to go very far in, just far enough that you'll hear when you're sucking on it. You can see Heidi's got the puppy upright. Alyssa has the puppy laying down, just about an inch. And it's just like sucking on a straw when you're drinking a McDonald's soda or a McDonald's milkshake. You can hear when you're in the fluid because it'll gurgle. So you just gently move it around. And the Dealy mucus trap, this piece that goes into the puppy's mouth is very soft, very flexible. So you can't hurt the puppy, but it's really intuitive. When you start using it, you put the one in your mouth, you start to suck, and it just makes sense. It doesn't really take a lot of significant training. It just makes sense when you do it.
Christine wrote, what do you think of the use of strips or other devices like dog ovulation kits like the Draminsky to figure out the ovulation of the bitch in order to pinpoint the ovulation and to indirectly optimize the number of puppies produced when we cannot have easy access to the progesterone tests and their interpretation? Are they useful? Which seem to work the best?
I have not had wild success with any of those. I've tried the Draminsky. I actually have one because somebody was giving it away since they were so disenchanted with the use of it. I'm not a fan. The semi-quantitative progesterone tests are better than nothing, but they're not as good as the quantitative. And there is a product on the market. I don't know what the availability in Canada is, but it's called the VTech, BioNote VTech, BioNote VTech. And that runs quantitative progesterones. It's about $2,500 for the unit. And then it's about $8 for every test that you run. So it is pretty close to affordable enough for some breeders to go ahead and purchase, or perhaps your breed club to purchase, or several of you that live close together to purchase, so that you have access to progesterone quantitative testing. And we've had very good success with that for repeating that test result. We have 5 progesterone machines in our practice. So I tend to compare progesterones across a lot of different pieces of equipment. And I've really been happy with the BioNotes results.
Jill wrote, Dr. Greer, could you please touch on the temperature drop of a bitch prior to whelping?
Oh, yeah. It works about 60% of the time, which means 40% of the time it doesn't help you at all. So 60% of the time it'll drop a degree or 2, and then it'll come back up and stay up when she's ready to go into labor. When it's accurate, it's helpful. When it's not, maybe you took the temperature of the inside of a piece of stool. Maybe she's just going to be one that doesn't drop. I don't use temperature drop as the only parameter that I would look for. My bitches, I can usually tell when they're going to go into labor. They get a faraway look on their face. They start to nest. They start to lactate. They kind of go into their own little zone, their own little world. Like the rest of the dogs will bark and they'll just be in another little part of their own world. Like they don't know exactly what's going on. They're just focused on their belly. So it is kind of interesting. I don't personally take my dog's temperatures because I use other parameters to really assess when they're going to go into labor. And you know what? They go into labor when they want to. So there isn't much you're going to do about it anyway.
And Lynette wrote, should you always do a C-section for litters of 9+?
I recommend that for litters of 9+ because we have higher puppy survival rates. Are there bitches that can whelp 14 puppies and be successful? There are, but you have a higher chance of losing puppies when you get above 9. So I like to just schedule a C-section, get it over with, be done with it, and know that I've got all the puppies out. I can deliver puppies 60 seconds a puppy. So even on a litter of 14 puppies, within 20 minutes of induction, I've got all my puppies out. So it's just a much safer, faster way for puppies to be delivered. We see higher puppy survival rates with C-sections by 5 to 6%.
And Charity wrote, can you suction too much or cause harm suctioning with a D-lead catheter?
If you are too aggressive with it, you could cause harm. It's soft, it's flexible. If you're gentle with it and you use common sense and just gently move it around and you're hearing the fluid and seeing the fluid, you're really not going to hurt the puppy. If you go nuts over it, yeah, you could hurt a puppy. But I have never seen even my inexperienced staff cause harm to a puppy with a D-lead. It's very intuitive and it's very safe.
And Julie wrote, where can I get a breathing tube for a puppy?
Oh, so the blue tube that I showed, the Cole tube, that is sold through the veterinary distributors. It's called Cole, C-O-L-E. So if you're in the veterinary field, you should be able to order those. This is the blue tube. These are little laryngoscopes. And then the stylet, if you're interested, I'll teach you how to make one of those or I'll send you one. But that's called Cole. The nice thing about this tube is, like most endotracheal tubes, have a cuff on them that you inflate. And that just doesn't work in a newborn puppy. So this Cole tube has this stair-stepped type. It's larger at one end than it is at the other. And once you slide it in, that place where it jumps the width a little bit will cause a nice seal in the trachea. So it's called a Cole tube, C-O-L-E. And the veterinary companies will carry those.
Trish wrote, how soon after a puppy is born do you recommend they start nursing?
Oh gosh, as soon as they're ready. So some puppies will come out like ready to nurse. They've flipped, they barely got their placenta detached. Their mom's still licking them off and they're already starting to nurse. So the sooner the better. There was a study that I was just reading about in dairy calves that said that they could correlate poor suckle reflex with poor survival. Now, I don't know exactly how you quantify that. I'm kind of interested in how can you tell if a puppy has a good suckle reflex or not? You know, do you stick your finger in their mouth? Do you watch them nurse? How do you assess that? But we know the sooner they nurse, the sooner they get colostrum, the better the chances of survival are. So as soon as they're ready to go, I let them nurse.
Gabby wrote, do you tie cords with floss or just clamp when they are born? She also asked, are betadine and iodine similar?
Betadine and iodine are similar, but they're not quite the same. And yes, I tie the cords off if we do C-sections because there's no mom there to tear it. If the bitch has delivered the puppy and the cord isn't bleeding and she's either bitten it off or it's torn as the puppy was born and it's not bleeding, I just leave that alone and dip it unless it's really, really long. But I use a lot of dental floss. If I'm at home, I use dental floss. If I'm at the practice, then I use suture. So it depends on where the puppy's born and what the circumstances are. You want to control bleeding most of all.
Christine wrote, how is vaccinating a bitch before breeding her, or how can vaccinating a bitch before breeding her affect the outcome of healthy puppies, and how long after vaccinating should we wait to breed a bitch?
So the recommendation is to not breed or not to vaccinate when they're in heat. That's from Jean Dodds. And the thought is that you run the risk of an adverse event from the vaccination interfering with the conception of the litter. The only time you should vaccinate during a pregnancy is if you are in the European countries where you have access to the herpes, canine herpes vaccine. So otherwise we don't vaccinate when they're in heat or when they're pregnant. You can vaccinate before she comes into heat if you want to see that her immunity is high, or you can do a nomogram, which is the blood test that checks the titer. And then based on that test result at the University of Wisconsin CAVID lab, CAVID, they can tell you what the bitch's titer was. And then based on that, tell you how to customize the puppy's vaccination protocol. So there's some kind of cool stuff you can do if you decide to do the blood test to titer the bitch instead of just vaccinating her.
Laura wrote, if you have to bottle feed a puppy, what is the best way to do this and what formula do you use?
I use either foster care or Esbalac, the goat's milk version. Bottle feeding, I will use the MediNurser or the Miracle Nipple. Now the MediNurser is made by Nuby, N-U-B-Y. It's a German company and it's a little tiny 1 ounce bottle. It holds 30 cc's and it's really made for human babies to administer medication with, but it works beautifully for large breed puppies. For small breed puppies, I use the Miracle Nipple small size. For larger breed puppies, I use the Miracle Nipple bigger size. And then the guy who makes the puppy warmer incubator is working on some nipples. I'm going to show you some nipples tomorrow night from Amazing Nipple, and I'm going to talk about his nipples tomorrow night. They're made out of silicone and they're really nice for puppies. So we'll talk about a couple of options tomorrow night when we talk about feeding.
Trinity wrote, how long should puppies be actively monitored after birth?
Well, that depends. If you have an experienced dam and you trust her and the puppies are strong and you feel pretty comfortable that things are good, probably not as closely as a new first mom. A bitch you don't know is going to be trustworthy. I've seen bitches damage entire litters from being just too aggressive with them. So I tend to watch them pretty closely until I am very comfortable that the bitch is good. She's not going to lay on him. She's not going to hurt him. The puppies are all getting on to nurse. Sometimes you'll have a puppy or two that are small and they're just not competitive at the nipple. And you've really got to watch those puppies to make sure that they're nursing, they're gaining, their urine color is pale, they're gaining weight, they're staying warm. So it depends on the litter. My corgis, I have to watch much more closely than my farm dogs. So it depends on the breed, depends on the dam, it depends on the circumstances.
Adrian wrote, how many puppies can you fit in that puppy warmer?
Oh, I had a client with 13 bull mastiff puppies fit on the whelping nest. all of them on one whelping nest. Now, that was only the first day after they were born. And as soon as they started to gain weight, it got a little crowded. But you can actually fit a pretty good sized litter on that whelping nest.
Oh, and Jill wrote, if you have a large litter and the puppies are all spread out with 24 degrees ambient temperature, is it better to lower the ambient temperature if they no longer gravitate to the below heat source?
I usually keep the ambient temperature where it is, around room temperature. And then I'll lower the heat source temperature by a couple degrees and just watch them really closely. They're going to tell you if they're cold, they're piled on top of each other. If they're warm, they're spread out. Some of the northern breeds, like the Samoyeds and the K-Sounds, they get hot at those temperatures that other breeds are pretty comfortable at. So I'll really watch those. If you're not sure, if you think the puppies are too hot, put on a wet, cool towel and see if they crawl onto that. And that's going to tell you if they like that cooler temperature. So I kind of let the puppies talk to me about where they're comfortable. And like I said, we know that puppies like a temperature gradient. So when Ken Sundin at Puppy Warmer developed his first incubator, he had it exactly the same temperature in the far corners as it was in the middle, and the puppies weren't happy. He found out pretty quickly that they like that temperature gradient because a puppy will move back and forth between cooler and warmer places. So I'll really let the puppies make some decisions, but like I said, make good decisions. So I don't want them off getting chilled, but I want to give them some options for where they want to be so that they're more comfortable. Let them tell you what makes them comfortable. If they're crying and you take their temperature and it's 102, or if it's 37 degrees, they're hot. So turn the heat down where they are. So let them tell you. And the reason I like the ambient temperature to be room temperature and the puppies to be warmer, I don't want the whole room so hot that the bitch is miserable. She won't stay with the puppies. She can't drink enough to stay hydrated. She's hot. She doesn't want to be there. You want the bitch to be comfortable. If you're too hot to sleep in the room, it's too hot for the bitch. It's too hot for the puppies. Turn it down to room temperature and then have that additional heat source from underneath so that they can pick where they want to be.
Jill wrote, just for Dr. Greer, how can she contact you to get a signed book?
Oh, I can give you my email address. I think I have it on the very last slide for tomorrow night. So we'll just flip through this really fast. This is the preview for tomorrow night. So now you don't have to, you can just all watch this really fast.
Yeah,
And
there
then
we go. Yeah.
Yeah. So we're done now. We'll skip tomorrow night.
Thanks for coming, folks.
Yep. So I talk really fast. There you go. So that's my email address. So we're good now. I'm just going to go home tomorrow night and cook.
Good night, doctor. Nancy wrote, when can you start calcium paste for labor?
Oh, good question, because we didn't talk a lot about labor. This is more neonatal stuff. So you can start the calcium paste at the very first sign of labor. So if her temperature drops or she starts nesting, I start the calcium paste. Now, there are some people who aren't big fans of the calcium paste. I think it makes a huge difference. I think it's going to keep you from having to use too much oxytocin. I think the bitch isn't going to wear out as fast. I think she's going to have a faster delivery. So as soon as she goes into labor, I start the calcium paste or the injectable. Now, the calcium paste doesn't work quite as fast as the injectable, but it works faster than tablets, faster than powder. So the paste is really my go-to for bitches in labor.
And Brent Spur wrote, what is the recommended oxydose for a Labrador?
Oxytocin, itty bitty dose, probably not more than 1/10 of a cc every 20 to 30 minutes. I use tiny doses of oxytocin. Most people use too much, and then it causes the puppies to have the uterus just shrink wrap them. Instead of the uterus having nice waves of contraction, it just crunches down on the puppies and they lose blood flow, so you lose puppies. So itty bitty tiny weeny little doses. You can always give more, but if you give too much, you can't get rid of it.
Odette wrote, do you use calcium between puppies and large litters systematically? If yes, which kind and what dosage?
I like the calcium gel. Oral Cal is my favorite because the palatability is so good. That's the Revival product. And I do work for Revival, but compared to the CalSorb product, which kind of has this astringent kind of drying of the mouth effect. That doesn't taste very good. The bitches don't like it. The CalSorb gel doesn't work as well in my hands as the Oral Cal Plus. The Oral Cal Plus, I found my own personal dog when the puppies were weaned. She got into the trash and found the empty tube and was chewing on the end of it. So I know that stuff must taste pretty good because she sought it out and was carrying it around, jumped up onto the bed with it and was chewing on it in her little front feet. So that product is palatable. It works really well. I've had good success with it. The CalSorb doesn't taste as good, but it's probably still a very effective product.
Susan wrote, how long between labor starting and heading to the vet if no puppies come out?
2 hours is as much as I'll let a bitch be in hard labor before I go in. Now, if she's just kind of kritzing around and nesting and kind of messing around, they can do that for a day or two. But if she's pushing and not making any progress, I don't let him go more than 2 hours.
Christine asks, what do you think about giving puppies Manuka honey after birth?
Well, honey has the concern about botulism in it for the human baby. So I don't typically give honey to the puppies. I do give the sweetened condensed milk or Karo syrup because we know that that doesn't have botulism in it.
Okay. And Jesseline wrote, what is the reliability of using in-house progesterone testing versus lab progesterone testing in getting a bitch pregnant?
That depends on which equipment they're using, how they're interpreting the results. In general, most of the in-house equipment is pretty accurate, but there are definitely differences. There's differences in the reference labs. Antec and IDEX don't have the same results for us any more than the Catalyst will have the same result as the TOSO or the BioNote or the Immulite. So there's definitely differences, but in general, they're pretty accurate and they're pretty useful tests to have.
And Terry asks, can you use the same D-leak suction for multiple puppies in the same litter?
Oh, yeah. I should have said that too. And yes, because we figure they all came out of the same place. So they're all pretty much going to have the same exposure. Between staff members, we bleach them in between. Now, each of my staff member has their own, but we bleach them after uses. We used to use chlorhexidine, but it tastes bad. And we found that during COVID, we needed to be using bleach as a better disinfectant, but we save the dealies and use them again and again. On the human side, those are used on when human babies are born. Midwives use those, but of course they're going to throw them away because the human side never reuses anything. On the veterinary side, we're pretty good at reusing stuff.
Lisa wrote, I hear you saying puppies have better outcomes from C-section, but what about the bitch? Is she more at risk from a C-section or natural delivery?
Well, natural deliveries are not without their risks. I have had a couple of bitches that have died during labor. It's pretty heartbreaking. Labor or very, very late stage pregnancy. Yes, there is a greater risk to the bitch for anesthesia and surgical infection, surgical bleeding, that kind of thing. That being said, I think C-sections are generally very safe. However, I never, ever, ever, ever spay at C-section. Never, ever, 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 ever. And if anybody's interested in information about that, again, if you'll send me an email at this email address, I will send you an article that I wrote about the risks of blood loss and going into shock and all the other things that can happen if the bitch is spayed at C-section. So I think C-sections are generally very safe. Are they without their risks? Absolutely not. But I have seen absolutely normal looking bitches die during labor. So there are people that happens to. It's horrible. Pregnancy and labor is not risk-free. It should be very low risk, but it's not risk-free.
Sarah wrote, do you have a list to make an emergency whelping kit with?
I do. And you know what? Let's put that on tomorrow night's agenda. I'm going to write that down, that and what the glucose level should be. So yeah, we can include that tomorrow night. And I'll send it to Alice as a handout as well.
And Susan wrote, For the cold tube, what size in millimeters would one need?
I use the smallest size they have. I think it's probably, let me look that up too, for the coal size. Because right offhand, I can't tell you, but I think the one picture I had, I'll look it up for you.
Okay. And Jill wrote, if you have a bitch that will not settle with her puppies, will calcium help?
Oftentimes calcium will help. The other things that help are the adaptil collar or the Thunderies collar. That's a pheromone collar, or the pheromone sprays that will help. I tend to save placental fluid, especially if the puppies are born by C-section. I'll save the placental fluid and put that on the puppies. That seems to help. Check your room temperature and make sure that the bitch isn't just so hot that she's freaking miserable and she's just like, I'm not doing this. I'm out of here. On incredibly rare occasions, under very careful circumstances, I will give a bitch light beer. Very carefully. Small dogs get small amounts, bigger dogs can have a little bit more, but sometimes a little bit of beer, light beer. Don't use your good alcohol, like 12% beer. Use your light beer. And sometimes that's just enough for her to drink a little bit and settle down. And once she's settled, they tend to be pretty good moms. But that first 72 hours for some bitches can be pretty rough.
Anne Marie wrote, how long is the normal delay for the first breathing that we can wait?
It shouldn't be more than like a minute or two. Sometimes it's a little bit longer, but I like to see those puppies breathing as I'm handing them off at C-section. I want them taking their first breath. So before they are 60 seconds old, I want them taking their first breath, and certainly by 5 minutes.
Okay. And Amy wrote, can you touch on the bitch afterbirth care? If not, could I message you after the seminar?
Sure. Afterbirth care for C-section or afterbirth care for free whelped? So yes, why don't you contact me and I'll communicate that with you.
Okay. And Pamela wrote, should the O2 in the incubator or whelping box be gradually reduced?
That's a good idea. It can be a little tricky to do. So yes, you want to start with the highest amount, and then you can start leaving the door open. There's really not a good way to adjust the amount that the machine produces. It's either 95% or 20, but you can leave the door open. You can make the space a little bit bigger that the oxygen's being delivered into. But yeah, instead of just going cold turkey from 95% oxygen to none, other than room air, it's probably a good idea to slowly decrease it. And like I said, I don't leave all my puppies in the incubator long-term, but if I have a sick puppy, a puppy with pneumonia, a puppy that's not thriving, I'll put that puppy in the incubator with the oxygen. And then I'll usually put another normal puppy in with that puppy, so that the puppy's not alone. I think puppies left alone think that they've been deserted, and I think they tend to give up and just quit. But if we can have another puppy in there with them so that they're moving around, and then I'll rotate so it's not the same puppy all the time, I think that's good. It also gives you an idea with that normal puppy in there. Is it too hot? Is it too cold? Is it too this? Is it too that? Is it too humid? And so if you have a sick puppy that can't complain that it's not feeling good, you've got that normal puppy in there as your canary in the coal mine.
Angela wrote, if the puppy is too warm, when do you worry about swimmer syndrome?
Okay, so swimmer is probably more a function of surface than it is temperature. So I'm pretty careful that my puppies aren't on a hard surface that doesn't have some flexibility to it. I like the egg crate mattresses, the ones that you can buy to put under your sheet and over your mattress. Those can be purchased at the store and cut into sections that you can put in your whelping box. I just had a swimmer puppy, a pug puppy, a couple of weeks ago, and he came back for a recheck last week, and I had the breeder get the egg crate mattress, and she said, I will never raise another litter of pug puppies without that egg crate mattress under the whelping pad. So that sort of corrugated up and down kind of mattress allows the puppy not to develop that swimmer puppy flat chest.
Kelly wrote, can the overheated whelping pen cause nosebleeds in the bitch, or is there another issue of concern?
It could cause a nosebleed if it's so hot and so dry, yes. But if she's frequently having nosebleeds, I'd be looking at her for some other medical condition, like a low platelet count, like Ehrlichia or anaplasmosis, one of the tick-borne diseases, Rocky Mountain spotted fever. I'd be looking at a tick-borne disease as a possibility as well.
Darlene wrote, is there a product that is safe to use to manage your bitch's heat cycles?
Manage them in what way? Maybe she can elaborate on that, because I'm not sure if she's asking to bring them into heat or exactly what she's asking.
Okay, so Darlene, you have to send that back to
Yep.
us.
More info, Darlene.
Christine wrote, how many milligrams of calcium should we give the bitch?
Depends on the size of the bitch. Calcium tablets are usually between 500 and 600 milligrams plus some vitamin D. So a small breed dog, I'd probably give a half twice a day. A large breed dog, I'd give 1 to 2 twice a day. So it depends on what breed you have, how big they are, how well they've been eating, what their calcium and their regular diet is, and if they're symptomatic, and how big their litter is. Small breed puppy or small breed bitches with large numbers of puppies need more calcium to prevent eclampsia than large breed dogs. I've never seen a large breed dog develop low calcium because of nursing their puppies, but I have seen small breed dogs like dachshunds and terriers do that. So it depends is the best answer I can give you.
And Jill Taylor wrote, after a C-section, how soon should you have the bitch up and going to the bathroom burst if they whelp naturally?
Pretty fast. My bitches are usually walking out the door an hour or two after their C-section, and they'll have gotten IV fluids, so they'll usually stop on the way to the car and urinate. So those bitches are usually on their feet within an hour after a C-section if the anesthetic went well.
Juan asked, does giving probiotics a must in a first week pup?
Oh, good question. And I think they should get probiotics. They're going to be exposed to bacteria in the environment from the bitch, from her fecal material. So I think getting the right thing in them early on is a good idea. The powders, you can put a little on your finger and put it in their mouth. The gels are nice to use. You can use some yogurt. So yeah, I think establishing the right bacteria from the beginning is a good idea.
Michelle wrote, do you give colostrum to the newborn?
All newborns should have either colostrum. Colostrum is always the first choice from the bitch. Now, the tubes of stuff that say colostrum on them, those are from cattle. Those are bovine colostrum sources. And cows don't get the same diseases as dogs. So bovine colostrum really doesn't give us the colostral effect that the bitch's actual milk does. So yes, they should get colostrum, but it should be dog colostrum.
And Trish wrote, can you touch on why you use condensed milk and how much you would give a puppy? Would you mix it with water or just give it as is in a syringe?
I give it straight. I give it if a puppy is weak. I give it if a puppy isn't starting to nurse very effectively. I also give it at the time that we do tail dock and dew claw procedures. And I know some of you aren't doing tails anymore. You might be banding, you might not. I know Canada's had some changes in that. But there was a study done in baby pigs at castration that showed that their cortisol levels were lower. They were less stressed if at castration they were giving glucose. So if I have a stressed puppy, a sick puppy, a puppy that's not thriving, a puppy I'm going to do a procedure with, then I'm going to give them some. For real little puppies, it's just a couple of drops. For bigger puppies, it can be a couple of cc's. And either the sweetened condensed milk or the Karo syrup can work really well for that.
Nancy wrote, is the calcium paste you recommend the Breeder's Edge Oral Cal Plus
Yes.
gel? Okay.
Yes.
Jean Robertson wrote, how many C-sections are considered safe for a bitch?
I have done as many as 5 pretty comfortably and have seen if the uterus was sutured closed correctly and well and the bitch healed up well, we don't see many problems with that many C-sections. After that, I think it might be a little too many, maybe 6, but there are definitely bitches that have had 5 and they do fine.
Cindy wrote, some bitches have a lot of clots and bleeding, some do not. Is there an explanation for this?
There's really not. Some of our C-sections leave with their cervix still closed, and there's no bloody vaginal discharge until several days later when the cervix opens up. Some of them never seem to have much discharge. Others seem to have quite a lot. I don't think there's a lot of good explanations for that. Some patients are just different than others. I think it also depends on how many puppies were in the litter and how many placental attachments there were.
Kathy wrote, without progesterone testing, how do you schedule the C-section timing?
You really can't schedule it without C-section timing. You can either time on the front end so you know what day she ovulated, which is my preferred way to do it, because we know accurately that a bitch should be pregnant for 63 days. So we'll do our C-section 61 to 62 days afterwards. 61 days for large litters or brachycephalic, 62 for regular sized litters and non-brachycephalic dogs. On the reverse progesterone, when you're testing at the back end of the pregnancy, it can be a lot more challenging because bitches don't all drop at the same rate. You can't graph it the way you can when they ovulate. When they ovulate, you've got a pretty good idea when they're going to go up. On the way down, I've seen them drop from 10 to 1 overnight, and I've seen them sit at 3 for 10 days. So it's a lot harder to time it on the back end with reverse progesterones than it is at the time of the breeding.
Okay. Jill Taylor asks, she quotes, my vets do sidewall C-sections, and many have said this is a horrible practice. What are your thoughts?
You know, I've never done one that way, but I know there are places that do them. If that's what they have good success with, go for it. It does prevent the weight of the abdominal content being put down on that incision. So they do it that way in sows, in pigs. They do it that way in cattle. If your vet is a large animal vet and they've had good success with doing the flank incision and they're successful with it, hey, do what works.
Matt Garrison wrote, you are so wonderful. Last question. How common is mastitis?
Oh, it's not that common, but when it happens, it's pretty devastating. I'm glad you think I'm wonderful. Maybe you could tell my staff that you like me. Mastitis doesn't happen very often, but when it does, it's pretty rough on the bitch. It's pretty rough on the puppies. We recommend that you bathe the bitch about 3 or 4 days before her C-section or before her whelping date with chlorhexidine shampoo. Get her good and clean. Have her on a probiotic. Those are all things that we think can reduce the risk of mastitis. My husband, my dear husband, took one of our bitches out after her C-section, 3 days post C-section, into the pasture to help move the sheep into the trailer. He's lucky he lived through that experience because I was not very pleased with him. And in spite of him dragging the 3-day post C-section corgi, mind you, close to the ground, out into the pasture to load the sheep into the trailer, she did not get mastitis and did not get an infection in her surgical incision. He's a lucky guy.
Remember that.
Yeah.
Darlene wrote regarding her question about the product to manage heat cycles, wondering about being able to bring a bitch into heat.
So my recommendation for that is, number one, make sure you're feeding an appropriate diet. So the first thing I always ask when a bitch isn't cycling is, what do you feed? And if she's not being fed Purina, Sport 30-20, they go onto that. That's my recommendation. Number two is I put them on Be Strong, which is another Revival product, Be Strong and ICSB CF+. ICSB is International Canine Semen Bank. They're based in Oregon, in the US. So ICSB CF+ and Be Strong. And if that protocol of Purina and those 2 nutritional supplements, I don't get a heat cycle within 14 days, then I will start cabergoline, which is an oral medication, a drug that you can get as a prescription item in the US. I'm pretty sure they have it in Canada as well. So that's my protocol, but I never, ever put them on cabergoline if they're not on an appropriate diet, because nutrition is so important to getting these bitches to cycling well. One of my technicians came to me 2 or 3 years ago, and she says, she's one of my repro techs. She said, my bitch hasn't come into heat. I want you to put her on cabergoline. And I said, not until you switch her food and not until you put her on Be Strong. And she sent me a picture on day 14, because I said, if in 14 days she's not on, I'll give you cabergoline. On day 14, I got a photo on my cell phone of the back end of her bitch in heat. So it works most of the time just to correct it nutritionally.
Okay, it's 9:30. So one last question. Gloria asks, can you elaborate on basic protocol for incubator use?
Yes, the incubator is part of the room, the system. So you can't just look at the incubator by itself. You've got to look at the temperature in the room, the humidity in the room, the whole environment, how big the room is, what the airflow is in, all that stuff. The incubator, then I have it turned on and warm before I put puppies in it, because I don't want to start heating it up when I'm putting a puppy in. It needs to be pre-warmed, and you need the oxygen running into there. So probably 20 to 30 minutes of pre-warming it before I start loading puppies. That's typically what we do at the practice. The mat in the incubator that we use is meant to be black and reflect the heat back. But when they're very, very new puppies, some of them are a little wet because of the placenta. So I'll put a black towel on top of the black mat until the puppies are dry. And then I keep the puppies at a temperature in the incubator that keeps their rectal temperature where I want it. So that normal rectal temperature is what I want. If the incubator's not warm enough, I turn it up. And if the incubator's too warm, I turn it down. The first hour, the first probably 20 or 30 minutes in the incubator, it needs to be warmer than it does by the time the puppies get to be an hour old. So we're monitoring rectal temperatures on our puppies after C-sections every 5 to 10 minutes to make sure that we're keeping the temperature of the incubator appropriate for that litter of puppies. You may have 10 big puppies in the incubator, and that's going to be a different experience than 1 2-ounce puppy in the incubator. So I use all those factors. There's not a just set it and forget it kind of thing. You've got to adjust it as you go.
I'm afraid that's all we have time for questions tonight. And I want to say, Dr. Greer, you are wonderful. What a great presentation. And thank you to ProPlan for making this possible, making this evening possible for us all. Don't forget, tomorrow night, we'll see you all again. And again, thank you, Dr. Greer. That was a great presentation.
Thank you very much. Thanks everybody for coming.